is transformed into global effect. You see, through water, in fact. You see,
BOD is balanced, very.
This
BOD is balanced.
See, that is what I was affecting the water. This external one itself is the cause. What you are telling, which one is causing BOD? That is the industries. So that is why I have given more importance to that. In fact, if you see that nowadays we don't get hill service, why? It's because of this only. The entire water from Kolkata and other areas, if you go, and gradually that zone is increasing. Normally, during the monsoon season, these fishes will come nearer to the shore and go inside. Now they cannot come to the shore near them because of the problem of pollution. That is right. I agree that if you go to the total recycle of what I have given earlier, hydrologic cycle, that is a part. That is a part of a total global warming. I agree with you also.
There is another point, 15 or 20 or 50 years later. Because due to global warming, the glaciers will not be there, at least in our country, but they are melting, and the main source of the rivers will decrease day by day. And that will cause the water resources, whether it is for either for irrigation or for drinking purposes. The rivers will be dry. Most of the rivers will dry. At least Ganga, Brahmaputra, etc. So that will the effect we will be seeing after 15 or 20 or 50 years later. The relation between the global warming and
global warming is the glacier is melting. The water level is up. And this
water level of the sea
will go.
No. What you are telling, if it is warming, then there will be a lot of water and there will be flood. So there will be no question of water shortage.
Water shortage of the river. That is most of our water.
Not from the glaciers.
Of the glaciers.
Not from the glaciers. I'm telling you, that is because of siltation.
So we will be not going to.
These rivers, they are also being degraded. What is called degradation of soil, degradation of the area. Even in this Jaldaka river, it is totally closed because of the Bhutan big boulders are coming and falling on the river. So this is maybe that it will be glacier, because once the glaciation will come, then the entire boulders and everything will close the river in entry to water. That is the problem. Then you find
still there.
so now global warming goes on in this industry. Whenever you plan, there should be a system of water harvesting. So in this part, water harvesting can be done two ways. One is by increasing the volume of water in the ponds, because there are a lot of ponds are there, which is really derelict most of the time. If you have fund or government have fund, they should increase the depth of the particular pond. This statement I have not gone into the details because every area of water is so important. I have given a very globalized way, very everything on water. Particularly it refers to how it affects us. Any question I can answer? Okay, then
we can discuss questions if any other at the end. Okay, thank you. So thank you very much, Dr. P.K. Chatterjee, for his stimulating presentation. Our next speaker would be Dr. Dilip Bhattacharya, our TCA doctor. He will be speaking on
that is the place which I have been visiting during the last few years. But before I begin my speech formally, I am to say that I am very grateful to this center, to Dr. Chakraborty and his colleagues for allowing me a space here to talk. And if we talk about a rural health center, then I would say I only wish we had many more centers like this in many more villages or semi-rural areas, because the real service given by this center is rather surprising. And as we know, here we have at the official government level very little of healthcare. We must say that this is not a criticism, but an admission of fact. So, in these two places where I go, the population is different from each other. Both are rural, both of them are poor, but the poverty is more pronounced in one place, that is near Butiari, than in the other. Toronto Calcutta Association is not a very financially strong organization, so the resources they have is very limited. And we know very well that only once a week we visit them. If we miss one of the trips because of, say, holiday or other reasons, I know, and all of you probably can imagine how devastating an effect they have on the people awaiting us. Butiari is a place where the poverty is very much pronounced. But more than that is the illiteracy. Along with illiteracy and poverty, there is an effect of the religious organizations. So that what the local preacher says is more effective than what the local doctor says. And the concern to us is mainly about the hygiene, about the local drinking water facilities, about the awareness of, say, washing hands in scheduled times, and so on. As poverty is very pronounced, we have said, so you can imagine during this season, not many of them are well dressed. When I say well dressed, I am not talking about the look. I am talking in terms of protection from cold and dust. So this is the time of the year where we have to spend more time prescribing them antibiotics because of chest infection. This is the time where we have to spend more time giving them, say, bronchodilators, because many of them have asthma. And these chest infection and asthma, these are preventable. But unfortunately, we cannot prevent. We cannot prevent because they don't have enough money. They don't dress their children enough. They don't take care of the situation at home. And in addition to this,